Nutritional assessment station in your NMC OSCE is one of the silent station. It is not totally silent station. You will be talking in the latter part of this station. So we cannot say it is 100% written station. Okay, in your step 1, you have to calculate the BMI score of this patient. The weight of the patient in kilogram over the height of this patient in inches. It's not the normal way we calculate BMI. This is much more cheaper. If, for instance, on that graph, just like you are seeing on the screen, the weight of this patient is 50 kilogram and the height is 1.5 inches. All right, you just trace it. The kilogram, just like you are seeing, the weight is horizontal and the height will be vertical. Trace it together, see the area they interject and know which of the graph line it falls to. That will give you your score. All right, for step 1. For step 2, it is the amount of weight that was lost in 3 to 6 months prior to your time of assessment. Okay, how will you get this? If previously this patient is having a weight of 72 and now the patient's weight is 65, you take 72 from 65. All right, whatever you are left with is what you will trace the current weight of the patient, trace it out, the range that you got. If, for instance, now you got a range of 5, difference in weight, that is 5, then you trace it to where you find the range. All right, it's the range, it comes in range. So this range, whatever the color falls in between, it's what you are going to write. Okay, so it might be yellow or green, so that will give you the score for step 2. And for step 3, if it is not mentioned in your scenario that this patient is acutely ill and has not been taking adequate oral intake for some days, this patient will still be scoring 0. However, if it is stated that this patient has been acutely ill and has not been taking oral intake properly for some days, all right, that will make the patient to automatically score 2. Okay, and in your step 4, sum up the score. It's as simple as that. And your step 5, which is the major work, you go back to your assessor and relay the findings. You go to your assessor and relay the findings to him or her. Okay, what are your recommendations? You are not to cram any, boldly written on the chart your intervention according to the score you are getting. And looking down onto the chart, you will see another for all risk category. You have to state that recommendation alongside, regardless of any score you are getting. I hope I've been able to shed light and clear your doubts concerning this station. Until I come your way in my subsequent videos, keep practicing OSCE.